Welcome to Sit and Stay, the podcast that breaks down the challenges of starting and maintaining a mental health practice into digestible chapters. Sit and Stay is presented by RipsyTech, an electronic health record company committed to addressing the mental health crisis in the United States.
Tom, good to see you again.
Parker, nice to see you. Happy post 4th of July.
Happy post 4th of July. Welcome back to the Sit and Stay podcast by RipsyTech. As you mentioned, it is post 4th of July. I was actually just on a brief vacation for 4th of July, and we thought, hey, this might be a good time to talk about vacations for mental health providers. Everybody takes them, but mental health providers maybe have a bit of an obligation to their patients to make sure that they are available in some capacity. I'm actually not fully sure what the ins and outs of this look like, so that's what we're here to talk about and get a good idea for what it is to take a vacation as a mental health provider.
Yeah, no, and I think the 4th of July is similarly. I had a brief vacation, and because the holiday fell on a Thursday this year, I think it's very enticing to just take that Friday off and make it a nice 4-day weekend and do something fun. And yeah, we were talking about office policies and getting coverage for call and things like that. But it's very relevant just to have a podcast on, lots of different topics around taking time off as a mental health clinician or as a small business owner and what that means when you do that.
Yeah, so let's dive into it. Why? My first question is why might it be important for a mental health provider to remember to take time off for themselves as well? Are there benefits to that?
Yeah, and within the mental health community, there's a lot of attention paid to this topic. It's also one within the physician or any type of clinician where you've entered a helping field because you're motivated to help others. You've found that rewarding and interesting. But it is well known that sometimes people in helping professions do not do as good of a job of taking care of themselves. And not trying to be too much of a downer, but we do know that some of the highest burnout and suicide rates come from helping professions. And so it is alarming news that for a lot of reasons, sometimes we forget to take care of ourselves. And when we're giving advice to our patients to plan for that self-care and planning around vacations and time off, that often we don't do that ourselves. So having run a large company with lots of employees, we tried to be generous with our vacation, and we would pay attention to people who had accumulated too much vacation. We never did anything as draconian as you better use all your vacation in a year or you're going to lose it. I think we let people accumulate up to a year and a half of unused vacation before they would start losing it. But we would look and say who hasn't taken time off, and we would have conversations about, you're not doing your patients any good if you are not taking good care of yourself. And, there are different personalities. There are people who are so passionate, you can tell it's not affecting them as much, but, or some people really don't like to travel, and especially with the pandemic. So then it's there's different strategies we can talk about around how to manage your vacation time if you are not one for week-long absences. But yeah, I mean, it's common sense, but it is not done enough that you've got to take that time off and take care of yourself in order to be the best provider that you can.
So let's talk about what happens when somebody does decide, I'm going to take some time off for myself. What are some good strategies for, planning around that and communicating to their patients ahead of time?
Yeah, and I think it goes a couple of different ways, where if you're, really going to be away for a week where it's going to be very difficult to access email or phone, or you're in another country, that's one type of planning you need to do. Or if it's from this last 4th of July weekend where one day was a holiday and you're just taking an extra day off, it's maybe a different strategy. For example, for this past 4th of July holiday, didn't post anything about taking the Friday off, which we can talk a little bit about why maybe that wasn't the best idea. But I think if you know your patients well and you have a smaller practice, it might be overkill to announce, hey, I'm not going to be around on this day. And so that's something for each person to consider themselves. I think if you are going away for a week and you have a panel of 10 or more patients, it's likely that you're going to have some issues come up with your patients that you want them to be aware of. And so you're going to need to notify all of your patients of your time off, and you're going to need to have some type of emergency plan in place that you can direct your patients to as needed.
So, well, you mentioned an emergency plan. What would go into that kind of emergency plan?
Yeah, and so this is another, the very basic and what's required by law is a message saying you're not available, and if this is an emergency, to call 911 or go to the nearest emergency room. So that's sort of a basic and something that's needed for after hours as well. I think that the bigger question is, are you going to speak to, if you're in a group practice, you usually have coverage from a colleague that's pretty easy to arrange. If you're in a solo practice, are you going to find a colleague who can cover for you and take a call from a patient of yours if they're having an emergency while you're away? Excuse me. I think, as we've talked about before, there are these coverage groups that you can join, and that tends to work well for, you have to help cover for people when they're out, but you have someone to cover for your vacations, and that depends on how often you're away. But if you do decide to arrange to have someone cover your practice, making sure that information is available on your website or through your email or through your phone, and getting that information to your patients ahead of time is the goal when you're on vacation.
Yeah, you mentioned coverage groups, and you mentioned information that would go on your website, things of that nature. Are there any bits of technology that can play a role in aiding in the process of communicating? Hey, I might be gone, or I almost got an idea of, like, is there an app that can connect providers to coverage groups when they do decide to take time off?
That's a really interesting question and idea, and I wonder if someone has done that. I actually don't know. I don't know the answer to that. The tricky thing about it is, it's all around the insurance billing piece.
Right.
And so, because in general the coverage on phone calls is brief, it's not something you bill for, but it's not something that you want to do for free. I know at our old clinics, even though there'd be many weeks where there was never a call, we would still pay the people whose cell phone would ring during coverage for that time. I think there can be, and this, when you do have someone else do coverage for you, when you get back, you're going to have to do a little bit of work to talk to that person or read their notes for the coverage. So it is a question now, with the ease of technology. Do you really want to let people just send you a text to deal with and just deal with it in the moment, versus having to do some extra work when you get back? And that's going to be different for every provider. I know for me personally, I'd rather just get a text message that someone's out of a refill and take care of it myself in a couple minutes with our EHR, then having them try to reach a different prescriber and ask about what medicine they're on and have to send in a new prescription, etc. So it is this comfort level. There are technology advances that make it much easier to handle a lot of stuff quickly when you're on vacation, and it's your comfort with doing that.
So, all really great points. Are there? You talked about something that I could handle now versus something that maybe I could handle when I get back. When a provider does come back from a time off, is there a sense of overwhelm, of having to pick things back up? Maybe things with their patients have changed since they have been gone. I mean, I guess it depends on the length of the vacation, but are there any tips on returning to practice after taking a vacation without feeling overwhelmed?
Always. It's such an interesting question and so relevant because last night I was in this situation where, really on this last little several day trip, I thought it would be very easy to find 15 minutes a day to check patient emails. I do have my cell phone, which the clinic number rings to, and people can send text messages to that number. Ultimately, I didn't check the work email, and even last night after a several hour drive to get home, just kind of didn't have the energy. In my mind, I was saying, well, spending 45 minutes now might save me extra time tomorrow morning, but we're human. We can't always find the energy to do those things. And I was a little disappointed in myself when I saw that an email came in, for a medication refill, of which asterisk, there are very few medicines that are actually an emergency to get a refill in right away in psychiatry. But that being said, I was feeling like I should have been a little more clear that patients could send a text to the clinic number. And this was actually a patient that has used that text often. So it was like, I felt bad that it was in an email and there might be a day without medicine. Again, not any sort of terrible crisis or situation. But in my mind, I thought, next time I'm away, even for just like a 3-day weekend, let me put on a little responder saying, hey, feel free to shoot a text here. I may not have access to email. And then,
right.
Yeah.
Yeah. Okay. Well, anything else that you want to say about, from the provider perspective of taking time off?
Yeah. And I think a 3 or 4 day weekend is much different from a week off. So I do have a full week off coming up in about another month. And on that vacation, I definitely will be doing 15 to 30 minutes of work a day because, a holiday weekend where weekends when there's no work or school for a child psychiatrist and holidays tend to not be too busy times, but a week off, with that is during the week, not spending a little time each day would mean a lot of extra work when you get back and a little concern of missing something more important. So if you are going away for a full week, for me personally, I'd rather spend that little bit of time each day to check email just for urgent items and make sure my patients know they can text the clinic number with emergencies. Mm-hmm. So that's what I'll be doing. For other people don't want to deal with that. That's when getting your coverage in place, if you are having an extended vacation, is important.
Yeah, I think that's, you're speaking to a pretty relatable experience. just for anybody who really takes time off at any job. I can speak for myself. I took last Friday off for the 4th of July weekend, and I had gotten an email from one of our customers with an issue, and I get notifications on my phone, which is maybe my own thing that I need to work out with myself, setting better boundaries. But knowing even, you can set the vacation responder. I had also spoken with this client ahead of time to let them know, like, hey, I will be unavailable on these days. But, when you see that little message, I can't help but just forward it to somebody who I know is available, who's going to be able to help that person. I'm not, I have enough boundaries to say I'm not going to, sit and solve the whole situation, but I can connect them to the person who can. And that's a me thing, but, granted, I was not on a trip with my partner. I think if I was, then my partner would have maybe told me, hey, no, phone down, we're on vacation.
Yeah, no, I agree. I'm sure everyone has to deal with this. And, people in tech or lots of other industries, if you're on vacation for a week, they don't usually take your work and give it to someone else. It's going to be sitting there and waiting for you when you get back. And for people that's traumatic to, doing a little work on vacation to manage that, it can be the right move. I think when you're taking clinical care of people, there's this little extra standard to be aware of, but the idea that your work is going to be there when you get back to it, and so everyone has to figure out what they're going to do when they go on vacation. There is this trend. I don't know if we've talked about this, but just on a little psychology and around vacations, there are lots of companies in Silicon Valley area that tell people they have unlimited vacation. You can take off as much time as you need. And, I'll tell you that the reason they do this is because in every study of every company that does this, people actually tend to take fewer days of vacation than they would if they had set vacation. So it's a strategy that saves businesses money, both from the idea that people take less vacation, but also with respect to the fact that you don't have to, there can be some creative bookkeeping things you do when you don't have any assigned PTO hours to your staff. And you can imagine that if you're in an unlimited PTO company, that your PTO accrual as an employee is always zero because you have unlimited PTO. So that means it's not a liability or an expense for the company and can make certain bookkeeping things look better. But at the companies I've run, we always give people vacation, so we make sure they can take it.
Yeah, that's really interesting. I really had no idea about that, but the more you think about it, it makes a lot of sense. I'm definitely a fan of being able to say, this is my vacation time and I don't need to feel bad about not working because everybody knows ahead of time I'm going to be gone. And I also find that when I come back from a vacation, I can come back to my work with a bit of renewed energy. I feel like I'm probably at my most productive when I take a little bit of a break and then I come back and then it's almost like you can look at everything that you've been doing for weeks outside looking in and say, how have I been doing things so far? Is maybe there a better way to be doing this? And I found myself that way today. So I fully support taking vacations. Everybody should take a vacation.
Agreed.
So speaking of vacations, we have been talking about, what if the provider wants to take a vacation, but there is also, and I think this rings true for a lot of mental health providers, especially those that see minor patients, that, seasonal changes do seem to have a large impact on the number of patients that they're able to see during certain times. Summer being a historical lull when it comes to seeing patients, as they might be going on family vacations. So is there a way to plan your time around that as a provider accordingly, or or are there just strategies for how to mitigate the lower amount of business you might be getting as a provider during those times?
Yeah, no, great question and comment. And I think regardless of the age you work with in mental health, there is seasonality to when you're going to be most busy. And for people who are running their own practice or part of a small group, if you're not working, you're not going to be making money is the way it works in private practice. So being very aware of when those lulls are in your workload and coordinating your vacation time around then, that is the solution to minimize lost revenue while still making sure you get time off. So if you work with a lot of kids patients, excuse me, it is the summer and Christmas break actually that tend to be logically when kids are off school and there's fun stuff happening and there tends to be less stress, so your patients tend to do better. The summer seems to be ever shrinking, at least out here in California, where I think some schools actually start back July 31st or something this year. The first school.
Oh my goodness!
It's been creeping up in August, and someone told me their child starts school July 31st. I was definitely surprised to hear that, but wow. Yeah. So making sure that you take advantage of vacations in the summer if you see kids, or whenever the lull time is for you as a clinician. Then you're not worried about not having a full schedule while your patients themselves are on vacation. I do think regardless of the ages you're seeing, if you're seeing kids or if you're seeing people who have kids as well, summer is the travel time because people do it around school holidays. So syncing up your vacation periods with those of your patients is the strategy to minimize lost revenue as a small group provider.
Just as a small aside, I think the latest I ever started was my junior year of college, the first year of the quarter. Granted, it was the quarter system. The first day of the quarter, I think, was October 2nd, which is drastically different than July 31st. So that's really interesting to hear. Okay, and I guess the last thing I wanted to quickly ask about was, you were talking about like a lull. Are there times where there tends to be a spike?
That's a good question. I think both for kids and for adults, we know that there's a spike in springtime in mental health symptoms. So,
oh, really? Okay.
And there are interesting. There've been interesting studies on this and seasonality to mental illness. There is something to what part of the country you're living in and days of sunlight versus cloudy days. And so it does vary geographically and by the population you serve. So I think, it is nice to have an ability in your EHR after you've been seeing patients for a while to actually look at when your busiest times of year were and when do you see the most patients, and you can sort of tell from productivity numbers which months you make the most money. And we try to provide all these robust accounting center and productivity management features in Ripsy. But yeah, so if you're not sure, like, try to take a look at when are the lulls, which you can tell by the money earned during different periods, and then use that for planning your next year's vacations.
What just out of curiosity, why the springtime?
There's different theories for this. I'll quote a theory that goes way back to my residency training days in the early 2000s, and I'll put a disclaimer that I don't know if there's been new research about this, but I mainly always go back to it because it's the most interesting, which is this idea that springtime is when people are in love, and those people who are not in love tend to get very depressed and anxious, and that shows up starting in teenage years and for adults. And so that's why there's this spike in mental health symptoms in springtime.
Is it, so I'm processing that. So
I like to go back to it because it gets that sort of reaction it's a big asterisk. There is real research on this, but I haven't, it's been like a couple of decades. So I don't know what new research has come out in the past 20 years, but.
Okay. I was just thinking, is it because of like, it's after Valentine's Day? What's the correlation between love and springtime?
Oh, and that one goes back to Shakespearean times, although I can't. Right, we're assuming that whole springtime okay. Love. I think there is something with the flowers blooming and sort of centuries old documentation of springtime being the time of love, but that is an assumption for the statement that I made, and good point. Okay. I can't quote the research article on.
Okay. I was thinking that like right around early fall would be a bit of a spike, going back to school, maybe like right after the summer ends, you took your vacation, but now maybe kind of like a post vacation, not feeling as great, coming off the highest highs, then maybe feeling some of the lower lows. That was my theory. But.
Well, we do know for kids that for high school kids, it's about a month after school starts when we can see a lot of depression and anxiety, because when this new school year begins, kids are usually pretty happy. You're not behind on homework. And then it's about a month in where you can be really behind on stuff and start stressing out. So depending on where you live and when that school year started, 4 to 6 weeks after that school year starts is when we see teenagers struggling as one peak, and then the other peak comes in the spring.
Gotcha. All right. I think we dived deep enough to we figured it out. All right. This has been great, Tom. With all of that said, let's transition into a mental health business moment of the week. What do you got for us this week?
Yeah, I mean, it's sort of good news. I thought I'd share. I'm sure this has been one of the frustrating moments in talking about delayed payments from insurance companies, but just last week we had problems with getting some insurance claims paid when a new doctor joined the group, and there was an issue where the insurance company, we don't actually know what the issue was, but it took 10 weeks, but and it arrived in the mail, but paper checks arrived in the mail with corrected EOBs, and we finally got paid for these charges that happened in mid-April on like July 2nd. And it was a few $1,000s, so it wasn't $50, it was a few $1,000s. And there was still, the check was made out to the wrong entity. That being said,
of course,
often you can still deposit those checks if it's a business account and they see it's from an insurance company you do business with, and so the deposits did go through.
Okay.
But so just nice. I always say, it will get fixed. I don't know how long it will take. And this was a situation where we had gone ahead and paid an employee, even though we hadn't received the revenue. But I did feel confident that at some point it would be resolved. And that point did happen. 10 weeks and a lot of email and phone call communications later. But happy to have that finally resolved.
Yeah, I feel like I've been closely following this for weeks now, so happy to have a positive result.
Very good.
All right. Well, I I think this has been another great episode. I'd say this would be a great time for us to conclude things. So thank you again for listening to the Sit and Stay podcast. If you have any questions that you would like to submit to us for a Q&A, feel free to send those to sitandstay@RipsyTech.com. And if you would be interested in being a guest, feel free to shoot us an email there as well. We actually have a few guest episodes that we're going to be recording over the next few weeks that we're very excited about. More to come on that once they actually get released, but we'll be staggering out those releases about one of those a month. But we're very excited to have our guests on, and more to come on that as it happens.
Awesome. Thanks, Parker.
All right. I'll see you later, Tom.
Bye.
Bye.
Thank you for tuning in to this week's episode of the Sit and Stay podcast. Until we meet again, we invite you to sit and stay with the ideas and stories shared today. Dive deeper into how RipsyTech can support your practice by visiting us at RipsyTech.com.